I will turn it over to Dr. Kelly Motadel. Thank you again for joining us, Doctor.
Thank you. Thank you. Yeah, so Congressman Levin already told you a little bit about me, so let me tell you a little bit about community health centers and Vista Community Clinic. Vista Community Clinic is close to 50 years old at this point that we've been in the community, and although we started in Vista, California, we now have 8 clinical facilities spread throughout 3 counties, including Orange County, Riverside County, and San Diego County. Last year we cared for over 70,000 patients. That the number of deaths, when Congressman said it, kind of hit me because it would be like wiping out our whole patient population of Vista Community Clinic. So we care for 70,000 patients annually for over 250,000 visits. And community health centers, we're just one of many community health centers, but San Diego County in particular relies heavily for the care of we're the safety net for the healthcare in San Diego. But throughout California, community health centers care for 1 in 6 Californians. So that's quite a big percentage of the care being provided. They take care of 1/3 of the state's Medicaid population. And that includes 500,000 migrant workers and 250,000 people experiencing homelessness as well. So our role in this pandemic is pretty critical for helping patients not only stay healthy for other reasons, in addition to the COVID, but also to keep them out of the emergency rooms if they are experiencing respiratory symptoms they believe are related to COVID. So, I talk to my staff time and time again, really what we are focused on is keeping people in their homes and healthy. And when we can't do that, we have the option to bring them in if necessary. And if necessary, we will send them. But we are able to be that triage line for them to know, is this something that really needs a face-to-face visit or not? Is this something that really needs to go to the emergency room or not? And with that, we can collaborate with the hospitals to help keep their census focused on the patients who really need to be there. We have switched to a lot of telehealth. So community health centers up until this point had not really been authorized to do telehealth visits at all. So, some of the larger healthcare organizations definitely were doing some telehealth, although not a whole lot. And anybody who's had any interaction with the medical community during this pandemic knows telehealth is a big part of what we do now. So we switched to probably close to 85% of our visits now being exclusively through telephone or video contact. And at the same time, we've had this steep learning curve for that. We are still having people come in for those visits that are necessary to come in for. Despite this, we have found that many of our patients are not seeking the medical care that they need. We've seen a 30 to 40% reduction in our visits. And this is where that financial aspect that Congressman Levin was talking about has really hit home for us. We're a nonprofit, so we run on small margins, and switching to telehealth was costly, and now seeing a drop in our visits is also costly for us. We're seeing people delay their vaccinations. American Academy of Pediatrics has said children, especially those 2 years and under, still need their vaccinations. So if you have children in that age, I encourage you to reach out to your pediatrician and find out how your child can safely get their immunizations, because most every pediatrician I know has found a way to make that happen. We are seeing that people are delaying their chronic care needs. So vaccinations being a preventive care issue, but also what about those diabetics and hypertensives that need to make sure they're staying in good control, make sure they are still getting education that they need. Community health centers are there to do that, and we are ready and wanting to do that because we want to keep everybody healthy through this pandemic as best we can. Congressman Levin talked a little bit about the funding, and we had some we missed out on some of that early on, but he's really been battling hard for us there in Congress, and we're so thankful and did receive some funds. But even the funds that we got really are covering about, maybe a month's worth of our losses. And as you know, we've already been in this for 2 months. So we're grateful that he's continuing to fight for our needs there to get us additional funding so that we can continue to take care of the community. We are concerned about what's going to happen after this as well. So those are the things we're doing now. But what's happening as we start to open things back up? What will healthcare look like? Well, I don't think anybody has the answer. This is a first for all of us. But some of the things that we are worried about is now we know there's a lot more uninsured patients in the community. And that's been a focus of community health centers all along, is for those that can't find care elsewhere. We want to be there for them. With this increase, will we have the capacity? Will we have the doctors and nurses and staff needed to take care of this increased volume? We are also concerned about those folks I talked about who have put off some of their primary care needs, their chronic conditions, their preventive care needs, all the mammograms that have been missed, all the colonoscopies that have been missed, all the pap smears that have been missed. We've got to get on those because we know the reason we do those is to pick up early disease. And so some of that disease won't be as early as it would have been otherwise had people been able to see their doctors face to face. We are also concerned about the behavioral health needs of our patients and of the community. So most community health centers have a behavioral health department, and we have kept ours busy through this, but we know that this is an anxiety producing first of its kind event for a lot of people. So even those who have not had an experience of needing behavioral health services in the past, we want to make sure they know that we are available to them as well, and we need to make sure that we can be and we have access to be. Behavioral health was already a little bit of difficulty with access prior to this. It was going to be even more important that we're able to get qualified therapists and psychiatrists into the community health centers to take care of those folks that need it. We are first and foremost seeing our role, as I said, to take care of the community and keep folks out of the emergency room. We don't have a playbook for this. We've been doing it as we go along. We're working with each other across different counties and across the country, seeing what best practices there have been, and I think we're learning a lot. And we're hopeful that at least a silver lining of all of this is that we will be able to do telehealth into the future as well. And I'm hoping that, for today, I can help answer some of the questions folks have and supplement the great information that Congressman Levin's going to be giving to you and keep everyone healthy.